Do you get menstrual pain that feels worse than normal cramps? Do you feel pain during sexual intercourse? Or are you having bowel movements even when you are not on your period or being pressed? What if I told you this might not just be a pain? It's not just period pain, but it's a real condition that claims and affects millions of lives of women in the world we are today. Hello everyone, welcome to Nurse Annie Med Talks. I'm here to help you understand your body in a simple, clear and real health information. Today we're talking about a common condition known as endometriosis. Before we begin, please subscribe to my channel, like this video, turn on the notification and help us to share this video to who you care about because women health matters a lot. What is endometriosis? Endometriosis is a condition where tissue similar to that lining the uterus grows outside the uterus, which is known as the endometrium. So this tissue growing outside is endometriosis. Earlier in our channel, we talked about when the uterus thickens. That means when the uterus thickens and the tissue prepares the uterus for fertilization, then it's going to shed down. Imagine this tissue being outside the uterus. That means it's in a place where it's not needed. During the shedding down, it's also going to shed where it is not needed. It can be found in a place such as the ovary, the fallopian tube, the pelvis, the bladder, sometimes even organs that are far from the uterus. It might be found there. Inside the uterus, the lining builds up and shed during your period and exists the body, but outside where it's not needed, it's going to build up there. It breaks down and it bleeds with each cycle. Imagine the kind of harm that can cause. It could cause inflammation, it could cause scar tissue. The build up is going to cause impaction on them. When that impaction comes, it then is known as adhesion. Doctors don't know the exact cause of this and is known as being idiopathic. That means the exact cause is not yet known. So what happens when all this occurs? Your menstrual flow will be going in a backward way, which is what's known as the retrograde menstruation. Cells then transform into endometrial-like cells and also immune system changes. This retrograde menstruation, imagine when the menstrual flow is going backward. So when it's going backward, it's carrying cells, it's carrying debris of cells. When these cells go there, they then implant in other organs where they are not needed or in other sites where they are not needed. When they stay there for a longer period of time, that could form tissues which look like that of the one in the endometrium, thereby causing an issue there. Why does this condition matters? Endometriosis does not just cause a bad cramps, it causes cases even severe than that. It could cause a severe pelvic pain. It interferes with everyday life. It causes bloating. You might see some women, they are always bloated. You'll be like, oh, I don't know why I'm always bloated. Yeah, normally during menstruation, a woman do get bloated, but aside menstrual period, they'll be bloated. Why are they bloated? It's because of endometriosis, which is one of the cases. What are the most common symptoms of endometriosis? Let's talk about it. 1. Painful period, not just cramps. A pain that's so bad that it stops you from your daily activities, it stops you from going to school, it stops you from going to work. The pain is severe and chronic. Also, this pain can be a severe pelvic pain that does not just go away even after your menstrual flow. It does not go away. Second one is what? Pain during sex. The third one, we have pain with urination. Imagine you just be urinating or having a bowel movement. That means when defecating, you'll be having severe pain. That's a symptom of endometriosis. Also, when you're having trouble getting pregnant, when a woman is infertile, well, this one is about 25 to 50% of women with infertility have endometriosis. Another symptom is what? Fatigue, bloating, nausea. Like you often feel overloaded in your stomach or in your abdominal region. This is one of the signs and symptoms of endometriosis. Most women these days take up to 7 to 10 years before they are being diagnosed with endometriosis, because whenever they do have these symptoms and they go to the hospital, or even within themselves, they'll just be saying, it's just normal serial and period cramp, which is not normal. Symptoms overlap themselves in conditions and quite alright, we know that. But when you are having a specific symptom, you have to know the root and detail of everything, because anything you are feeling, it's your body giving you a message or sending a signal that something is going wrong. Confirmation have to be done. How is endometriosis diagnosed? It's been diagnosed with pelvic examination, ultrasound, MRI, laparoscopy. Anyone that your health practitioner wants to do on you with your consent is going to be used. There are so many treatments for endometriosis, and we should be careful as a woman. You can't just be feeling this pain and you just go to a conventional pharmacy or conventional chemist. They should give you drugs for period cramps. That's not rational. You have to make sure that you are sure of what's wrong with you. There are some treatments that are being given just to aid this symptom and to alleviate, or rather bring down, the symptoms individual are feeling. They give pain medication over the counter, which is being prescribed to help the women with pain, and also hormonal therapies like birth control pills. When you give someone birth control pills, the body is going to see it as if the woman is pregnant. So now there is no shedding of the endometrium. So when there is no shedding of the endometrium, those tissues that are going to impact on themselves, causing a problem, there will not be a space for them to do that, because hormones are being blocked. The tissues are not being thickened, and also there is no growth. By so doing, the pain reduces. Also, the one and the most important and reliable way of treating endometriosis is surgery. Laparoscopic surgery, whereby the human is being opened and then they remove these abnormal tissues and scar tissue. It's going to help you reduce pain and also improve your fertility. By so doing, you'll be sure that everything is gone. You're not just tackling it with conventional drugs. Also, your lifestyle also help you. Eat well, exercise, also your heat therapy, stress management, also support group. Women having endometriosis, they do have support group whereby they go there, they share their experience with each other. By so doing, they will be happy, and also is going to help with their emotional changes. New treatments are emerging, and most of them are based on hormonal blocking pills and also surgical therapy. If you're living with endometriosis, it's not just physical, it's about emotional and social thinking. Pain interferes with work, it interferes with relationship. So it's not just about your body, it's about how you also relate with others. It's intimate than that. If you are going to this, your pain is real, your experience matters, and you deserve care. Keep a symptom diary. Whenever you have a symptom, just write it down. When you write it down, then you come and you cross-check, does a symptom match with any of these? If you see anyone that is alarming, then you can go to your doctor for therapy. Endometriosis affects fertility in the sense that it affects the way egg and spermatozoa meet and how implantation occurs. Imagine tissue being outside, so weak tissue will now help with implantation and also help with fertilization. And these impacted tissues on themselves, they call scar tissues. When they call scar, it's going to block the fallopian tube, thereby fertilization cannot occur, and also it's going to block the uterus, thereby implantation cannot occur. But many women with endometriosis can still conceive, especially when they receive the proper medical support. Endometriosis is complex, but understanding it empowers you. If you have symptoms like severe pain, heavy bleeding, pain with sex, if you have bowel pain, fertility issue, talk to your gynecologist or your health provider. If you find this video important and helpful, subscribe to our channel, so turn on the notification bell Share to who needs it. Leave your question in the comment section. I'll be there to answer them. Thank you for watching. Stay informed, stay strong. Take care of your health. Bye.